very much, folks. We're now going to hear from the London School of Economics. So we looked at prevention, does it work? And Warwick University and the team that they put together will help us answer that question. Prevention, will it pay? And we're now going to ask the London School of Economics to tell us how they intend to answer that question. Thank you.
Well, I don't know about answer it. Begin to address it, perhaps. You might have to move the microphones around on the basis that both Eva and I are less than 5'6" tall. See how it goes. Hence not standing behind the podium as well. I really hate podiums. Myself, I'm Jennifer Beecham. I'm Professor of Health and Social Care Economics at the London School of Economics at the Personal Social Services Research Unit. And this is Eva-Marie Bonin, who's going to be working on the project. At this point, some of you are going to kind of going, costs, tedious. Or some of you are going to be going, costs, work. Or some of you are going to be really excited about this. So I'm going to try and get most of you up to the, I'm quite interested in you at this point. So I thought I'd start with this slide, which is not going to be new to any of you, because that's why we're here. This shows children's age across the bottom, and the cost per week along the other side. And the red line shows the cost per week of supporting children over the number of years. This is social services data from the 2005 Children in Need survey. A little bit old, but the graph hasn't changed. This is all children in need, and you'll notice that between 0 to 3 years old, the price there for children in need supported by social services is about 200, 250 quid a week. And then you get this massive rise about the time children hit secondary school, right up until they're 16 or 17. Now, because this is children's services and social care, after the age of 16 or 18, it drops off. But we all know that actually the costs do extend further than that and often upwards to that. And the costs fall to the adult services, to the prison sector, and to the employment sector and to families and young adults themselves. What this initiative is trying to do is to raise the costs above Andrew's head, over the 0 to 3 years old, to try and bring down this big lump of costs at that top teenage years and hopefully beyond. So that's a little bit of context. And let's tell you a little bit about what we're doing in the economic study. It lasts 15 months, so we're due to finish in December 2004. And our final aim is to provide you with a tool that you can use for your local area to try and look at the additional costs you're spending on those early years, the likely outcomes, and the downstream cost savings. So it's a very early indication of whether what you're doing is doing any good and whether what you're doing is going to save money at those teenage years. So why should you care? Why should you bother? Well, we think this is quite a useful exercise because the very fact of having to use that sort of tool means that you are going to be recording somewhere along the line, and the Dartington tools are going to be very useful in this respect, things like staffing requirements, things like other bits you need to put an intervention in place. And when we use the term intervention, could you just interpret it in a very broad sense for the purposes of this today? So you're going to find out a really good early indication of what's worth doing for who, who's paying for it, but also who the beneficiaries are going to be. So not just who the family beneficiaries are going to be, but who's going to save money downstream. This kind of exercise will help you obtain more funding, so help you support your arguments for leveraging resources in, and also help you make your business case. So we think it's really important, and I'm hoping those people that are going, yeah, right, costs, are getting a little bit excited. Okay, so these are the sort of things we're going to be looking at. We're going to be using the evidence, we're going to be using existing literature, we're going to be reanalyzing large databases to try and find out what happens to children over 5 years or so who have problems in the areas that the initiative is targeting the outcomes of. Not a very good grammatical sentence, but it's close enough. And so then what we do is we look at how much these sort of areas cost currently. We then try and look at, from the existing literature, what difference does intervening make? And we try and look at that in a way that says, is this going to change children's trajectories? And here's a really, really simplified representation of that. And the figures are plucked out of the air, so don't go away thinking they're real. This is a child with speech and language problems. That might lead to poor peer and family relationships. And in turn, about 3/4 of those children, the figures here, might be not ready for school, or might have behaviour problems. And then obviously, many more blocks after that, poor behaviour problems, not ready for school might lead to poor school attainment, poor participation in the labour market, behaviour problems lead to all sorts of challenges. And then if we try and intervene in those children, we're going to reduce those proportions who have those consequent problems from that early speech, language and communication difficulties. Okay, so if you look at the third set of bullet points, what we want to find out then is, will those improvements in speech and language communication needs change the way that children and families use public sector services over a period of time? And then calculate the downstream cost savings that might accrue from those improved outcomes. Okay, so we're going to create these models in the first 5 years. We're going to try and give you a very user-friendly front face, so as you can then use it to input your local data to make your own estimates. And Eva's now going to show you one we prepared earlier. And we hope that's going to give you a flavour of the sort of thing that you might end up with from the work we're going to be doing. Eva. Oh, I forgot to do that. You're quite right. You've got a sheet in your packs that gives you a slightly longer outline of the project.
Right. And you've got another one, Eva. You've got another sheet in your pack that is a shortened version of a model that we described, that we did for the Department of Health. And what I'm going to talk about now is based on that model, just to show you what kind of things we're going through. You can read that at your leisure. So basically, what we want to look at is, if we provide an intervention, in this case it's parenting programs for parents who have children who already have conduct disorder and who are at risk of having persistent conduct disorder that then turns into adult antisocial personality disorder. So preventing persistent conduct disorder is the objective. So it's about preventing negative outcomes. And on the sheet Danny showed you, you also have that model. Basically, we need to look at various things to find out the answer to that question. So what happens without intervention? That's the first thing we need to know. So if a child doesn't receive an intervention, does it get better anyway? Some people will, some people won't. And once we know that, we need to know about how the program was implemented locally. So did a lot of people actually go? If they were invited, did a lot of people drop out? And it would be interesting to look at why that was and maybe who was more likely to drop out. And that's something we're going to come back to also. Then we need to know how effective is the intervention, what difference does it make? So if somebody receives the intervention, doesn't drop out, then we ask the question, how well does it actually work? Once it has worked for a person, do the effects last in the long term, or do people go back to their old behaviors? And that's then recidivism. And then, crucially, how much does it actually cost? And then the question that's related to that is it worth doing that intervention? and we'll find out if it's worth doing the intervention because we're going to weigh the cost of intervening against the cost of the problem. So the children with conduct disorder have a lot of costs that are associated with conduct disorder, for example, special education. There's something in healthcare, social care, but a lot of it is criminality later on. And I'm just going to quickly show you the model that's on that sheet that you have. The black line is what happens to children without intervention, and the red line is our base case for parenting programs. And basically, it plots the percentage of children who still have conduct disorder by age up until adulthood. And the basic point about this graph is just that the red line is below the black line. So with the intervention, there are fewer children with conduct disorder. That's the main point about that. Then here, you have the table on your sheet as well. It shows you who saves money from this intervention. I don't know if you can see it, but most of that is victim cost of crime with people who otherwise might have been the victim of crime, now aren't victims of crime, and that's a reduction. So it's more intangible, it's not a money value as such, but we can value it in pounds. And the other big one is the criminal justice system over there. And then just to illustrate that graphically by agency, so the NHS, savings to the NHS from that intervention, but 14%, criminal justice was the highest in terms of public sector services, 70%, and most of that is associated with the other costs of crime. So now, I hope you like this. This is the type of thing that we're hoping to make for you, and that you can then use to look at your own intervention. So you can see there, we've got some figures for the dropout, the effectiveness. Moderate is because in our model, children didn't just have conduct disorder or get better, they could also just have a reduced level of behavior problems. Then recidivism is going back to the conduct disorder type behavior after a quick period of time. And now we're going to check in our report. This is what you saw just before on that slide. And now linking back with what Naomi said earlier, that you have to provide interventions that people actually want. One thing that could happen if people don't like your intervention, they could be put both by feet, what we call it, and dropout could be 100%. So nobody comes afterwards. That's obviously an edge case. And now we check what happens if that's the case. And we see our big lottery case, which is the one that we've just changed, is now the same as the no intervention case, because nobody has a benefit from the intervention. And the comparison case is the age case, so that was actually better. And we can go on, we have no savings. And our model tells us that as well. Here, no money saved. So probably, if you're doing an intervention nobody likes, maybe not. Set that back. And I say effectiveness. What if my intervention doesn't work at all? So I put in 0%. And again, no money saved. I go back to my report, same results as before. So of course, that's not what we're hoping for. So let's say effectiveness is really good. So you're doing a really good job. It's implemented really well, 75%. Money saved. And we go look back at our graph, and we see the red line is well below the blue line, and that's what we want to see. Exactly. So going back to the PowerPoint. The one thing that we haven't touched on yet is in that model is the intervention cost, and that's going to be one of the bits of that model where we actually need a lot of input from you. In terms of data, when it comes to costs, we're going to need stuff like describing the intervention, including staff, travel time, what kind of rooms you were using, what materials you needed, for example, flip chart, pens, and the cost of refreshment. And I think it might be that you need to do a lot of that for your proposals anyway, so it might be worth starting to think now on how you're going to keep those systems going to track that over time. And in terms of the implementation, the data we need is take-up and dropout rates. The rest, the effectiveness and all that is going to come from somewhere else, and you also don't have to worry about the cost of problems, because that's what we're doing. So actually, you don't have to do that much, and you get a neat toolkit. So, but how does this intervention costing thing actually work? You have resource input, so that's your staff time and all that, which leads to directly improved outcomes, and also indirectly leads to better outcomes because you're producing services that then improve outcomes. That's in addition to non-resource inputs, so stuff you don't have to pay for, and that works the same way. So all these things come together to produce better outcomes, and resource inputs are where we get the cost of the intervention. So that's what we're focusing on. But how are we getting the cost of the intervention, you ask? You use the costing toolkit. Such as this. Does anybody, any area want to volunteer for this? No? Okay. Well, it's going to have to be regional data. So at the moment, this only distinguishes between London and non-London. So we're not in London at the moment. Imagine something quite pretty and rural. And so then we have to think about how many families is this going to be delivered to. Does anybody have a number? 20. We put in 20. So now what we need to do is we need to look at the resources we're putting into the intervention, because we've just seen that's where the costs come from. So there's going to be different phases of your intervention. So you need to prepare it, and maybe there's feedback later on, then you deliver it, and then there are other things like travel time, where you spend time. So different. So let's just say it's some kind of health visitor intervention. So the health visitor is going to be involved, and maybe they spend 5 hours preparing it. And then we have a social work team leader who's supervising all that, and they spend 2 hours. So now we're actually delivering the intervention. And let's just say, if the health visitor again, say, what's a good number? 10. Oh, 300. And we've got the team leader, we'll put them in like that. They're not doing that much, so they only get 5, and we'll just have another social worker who's also in with 250 hours. And you can see the costs start to appear on the right there. So let's just have a little bit of travel, let's just do the health visitor. And it's just a little bit of time. And now we've got cost of the room, 500 quid, and materials, use 10 for that. So you've got now the total cost of providing your intervention, and up there you have the cost per family. And that you can then weigh against the effect of the intervention and the cost savings that result from that. We'll change it. Let's pretend now that we're moving the exact same intervention to London, and it's a lot more expensive. Well, actually not that much more expensive. It's a little bit more expensive, but it's kind of similar ballpark type thing. So that's actually quite easy to use, I think, and quite fun. Going back to what we'll need from you. So we'll need all that input and how much time is spent on the interventions and all that. But we also, and more importantly, need the people. And before April 2014, so before the areas are selected, it would be good to start thinking now about how that type of information can be best collected, maybe within your existing systems, or if you need something else to put in that you can put in place that will make it easy for you and sustainable to collect that type of information. And we are happy to help you with that. After April 2014, we'll need some kind of research day long, somebody who talks to us, who can tell us where to go for what. But most importantly, even more important than that, we need someone who cares. Right? So, as Jenny said, cost is not for everyone. But if there's somebody that you know of who's really into this kind of stuff, or maybe somebody who's done it before, or somebody who'd like to learn about it, think about who that might be in your area, and then please put them in touch with us, because they're going to be the person we talk to, and we teach how to use these tools, and who will help us develop all these tools for you to make the best tool that for you that will meet your need. That's the kind of thing.
Thank you, Eva. Okay, I'll just do the last bit as you can imagine, lots and lots of unknowns at the moment. So we're going to be working with the Dartington team, with the Warwick Consortium. We're going to try and make things fit together insofar as they will, but lots of unknowns at the moment. After 2014, once the areas are selected, we'll be working closely with you. We want those research liaison people. We want to be able to reach out all the appropriate people in the area, so we're normal type of meeting and contact arrangements. We're rather hoping Skype might work better, a little bit better than we did this afternoon. Seminars and workshops, we've got a couple of those planned in each of those areas, so everybody begins to understand what we're trying to achieve. And then there's the potential to integrate with the Warwick Consortium dissemination and knowledge transfer systems. Again, a bit of an unknown as yet. We're working through those sort of details in the next 6 months. And that's everything. And Eva's screen says questions and answers.
Thank you very much.